Placebos without deception, a randomized controlled trial in irritable bowel syndrome. Yo, what's up? It's someone that's no one, and welcome back to today's report. Today's report is a case report where they cover the placebo effect. And here's the full report details. Alright, here's another research report. We haven't done one of these in a bit now, but this is the first report for this channel where nothing was actually taken. Well, no active substance was used, instead just inactive pills. If you've never heard of this method, it's known as the placebo effect, where even though we're taking something that is essentially nothing, just taking it or doing something and acting like you're being treated is powerful enough that it may actually work. In other words, the mind can be very powerful. This report covers IBS, a condition with the stomach, and they do get some mixed results, as you'll see. And I also will say, the only thing we actually do keep is the abstract, while everything else does get summarized. But let me know if you enjoyed this, subscribe and like, and without further ado, let's dive right into this. Abstract. Background. Placebo treatment can significantly influence subjective symptoms. However, it is widely believed that response to placebo requires concealment or deception. We tested whether open-label placebo, non-deceptive, and non-concealed administration is superior to a no-treatment control with matched patient-provider interactions in the treatment of irritable bowel syndrome, IBS. Methods: 2-group, randomized, controlled 3-week trial, August 2009 to April 2010, conducted at a single academic center, involving 80 patients, primarily female, 70%, mean age, 47 ± 18, with IBS diagnosed by Rome 3 criteria, and with a score of 150 on the IBS symptom severity scale, IBS SSS. Background and motivation. Placebo effects are well documented, but the conventional view is that deception or concealment is required for a placebo to work. This raises ethical issues in clinical use. The question this study asks, can a placebo still exert beneficial effects when patients know it's inert? The authors test open-label placebo in a randomized trial in patients with irritable bowel syndrome, IBS. Design and methods. 3-week randomized control trial, comparing open-label placebo versus no treatment control. Both arms had matched patient-provider interaction. 80 eligible IBS patients randomized, allowed to continue stable background therapy. Placebo arm participants took inert capsules, twice daily, clearly labeled placebo, with a persuasive explanation about how placebo effects may trigger mind-body self-healing. Outcomes measured at baseline, day 11, and day 21. IBS Global Improvement Scale, primary, IBS Symptom Severity Scale, adequate relief, quality of life. Also collected qualitative feedback about patients' beliefs and disappointment. Results. Open-label placebo significantly outperformed no treatment on global improvement. Symptom severity and adequate relief also showed statistically significant improvements in favor of open-label placebo at both time points. Quality of life improvement trended in favor at endpoint. Effect sizes: large for the primary outcome, medium for symptom severity, and quality of life. 59% of open-label patients reported adequate relief versus around 35% in control, comparable to what some drug trials report. Adverse events were few and mild. Qualitative data suggest that patients generally understood they were taking placebos, and most control patients did not feel overly disappointed. Interpretation and implications. This trial demonstrates that beneficial placebo responses can occur even when participants know they are taking inert pills. It challenges the notion that deception is necessary for the placebo effect. The ritual of taking a pill, the expectancy context, and the clinician relationship may drive the effect. Because deception is ethically problematic in medical practice, open-label placebo offers a more transparent way to leverage placebo effects. particularly for diseases with subjective symptoms. In principle, open-label placebo might be tried as a low-risk initial option before resorting to pharmacotherapy, but only after further validation. Limitations and cautions. Small sample size, short trial, preliminary findings, possibility of reporting bias, potential disappointment bias in controls, though qualitative data mitigate this concern. Participants self-selected by interest in mind-body treatments may limit generalizability. The reliance on subjective endpoints means caution in extrapolating conditions with objective biomarkers. Conclusion: open-label placebo may be a viable and ethical approach to harness placebo effects in medicine. The findings support further research into the mechanisms, durability, patient selection, and scope of conditions to which this approach might apply.